let me tell you something here. If I was going to do one good to the public, now I'm going to do 10 goods.
Well, hi, everybody. I'm Kim Skorupski, and you're on the Faculty Factory podcast. I hope you've checked out the facultyfactory.org. And a little plug is that we are ending year 3 of the Faculty Factory podcast, which we've called the Triple H series, the Habits and Hacks from Hopkins. We're moving into year 4, and I know many of you have so much to share, and you probably love to be on the podcast. And so I'm going to ask you to reach out to me or put an email in the facultyfactory.org website, letting me know that you want to be a guest on the Faculty Factory. You can contact me personally at K Skorupski. That's KSKARUPSKI at JHMI, which stands for Johns Hopkins Medical Institute. Institute or institution, Fawaz? Is it institute?
Institute, I think institute.
And you won't believe it. I actually wrote down my own email address as if I don't know how to spell my name. Anywho, that's my plug. And listen, everybody, you are in for a real treat, because on today's episode, one of my most favorite people at Johns Hopkins, Dr. Fawaz Al Ammary. Fawaz, good morning.
Good morning, Kim. It's always nice to be with you. Thank you so much for this conversation.
Well, okay. So I'm so excited. I just cannot wait to get into this conversation. And again, turn up the volume, settle in. This is going to be a great, great story. Dr. Fawaz, will you please start by telling everybody who you are here at Hopkins and what you do?
Sure. I am a kidney transplant physician and a health services researcher. I do see patient, outpatient clinic, inpatient. I do consult in the medicine department, nephrology division, and I do research, and my focus in increasing living kidney donation in the United States.
Well, there you go. There you have it. Dr. Al Ammary, will you please begin by sharing this very, very important story?
Sure. So this story, I will tell you, Kim, and the audience with mixed feeling, really. But I think the point I want to really let people know that what the take-home message is really, I want you to stay positive, no matter what, and even if, and you can fill the blank, your story in your life. So I just can tell you, like, on the Father Day of 2021, this last June, I was visiting my children in Denver, Colorado. And I met with my children on Saturday, and we had nice time. And then we had the plan for the next day morning to have breakfast together on Sunday for the Father Day. So my children left, and I stayed at the hotel in Denver. And my friend came pick me up around like 7:30 p.m. We went to a restaurant in a very fancy area in Denver called Cherry Creek. And we stayed in a nice restaurant in the patio outside. It was so beautiful weather, nice. People are very peaceful. And we finished eating, and we paid the bill, and we just had conversation. I was talking to my mom by phone, and then I hung up, and just were gonna leave. And suddenly I heard something so strong, like a bomb, hit my face. I have no idea what happened. And I lost my vision for about 30 seconds, but thanks God, I was still conscious. And I heard people saying, come after him, call the police. I have no idea what's going on. So, and people told me, come to the floor. So I took myself from the chair to the floor, and my vision came back, and I saw like a lot of gush blood coming from my face. So I kept pressure on my right side of the face to hold the blood coming out. And I hear people going on, things happen. I have no idea what happened, honestly. But the good thing, I stayed calm, and I just say, I hear people, I just said, what is my friend? I was worried about my friend, what happened to him, because he was sitting in front of me. and they told me your friend is fine. You were just trying to run after the guy who hit you. So it sounds somebody hit me. I have no idea what happened. Anyway, and the ambulance came, and they took me to the ambulance, and they told me, we'll take you to Denver County Hospital. I told them, could you please go to University of Colorado, because I used to be faculty there and I know everyone.
Oh.
So the nurse was so kind. He said, "You're a doctor." I said, "You know what? We'll just follow your recommendation. Although it's going to be double the trip, but that's fine." So I was happy they took me to University of Colorado. Now, until that point, I just heard somebody hit me, and that's it. I have no idea what happened. I'm so grateful that at the University Hospital, I got really great care from neurosurgery, trauma surgery, ophthalmic, ENT. I had severe injury in my right, above my right bra, and I had also non-traumatic injury of my right eye that caused optic neuropathy. Now, thanks God, they did all the CAT scan, all the images. My brain was not touched at all. So my brain had no injury. I got a lot of maxillofacial fracture and nasal fracture only. So, and of course, there was like busy night, and I had some symptoms at that time. But despite all of that, I didn't have, what's interesting that I didn't feel pain. And the doctor keeps telling me, do you need narcotic? Do you need pain medicine? I said, I don't feel pain. They told me, well, you're probably going to have pain, severe pain from the injury. I said, well, if the pain happened, I will ask you for pain control. So then my friend, came, and then I told him, what happened? He told me, well, what happened, we were sitting, and there was a guy coming from my behind, walking toward us. He was wearing like a shirt, Grubhub sign, and has a red banda. And he was carrying like a big bottle of wine, like black wine glass, big bottle basically. And my friend told me he looks suspicious, but I thought he just, making a delivery or something. When the guy came near our table, he just hit my face and run away. And there was a truck waiting for him across the street, and he jumped in the truck and he ran away. My friend tried to catch him, but he couldn't. There was another guy who ran after the truck, took the picture, and they got the information. Unfortunately, all the information, the police did the investigation. The truck was toasted, and they left no fingerprint. So they were very clever how they did it. But the good news that out of this, that I was doing well and I was alive. So what was concerning me at that time, I promised my children I'm going to see them next morning to have breakfast together, and the recommendation was to stay in the hospital for observation. So I told, I met with all the surgeons. I said, if you feel you do something, do it. And I got all this more than 20 stitches above my eye, and they did a great job, really, like plastic surgeon did it. And they told me, listen, Dr. Ammary, if you want to leave, it's fine to meet your kids, have nice breakfast with them, and come back after. So I said, great. And again, they were so worried that I have to have pain medicine. And they said, we're going to prescribe with some pain medicine. There's no way you're going to have no pain. I said, that's fine. You can prescribe whatever you want. I'll use it if I need it. Thanks God. I told my parents, again, all this happened. I didn't feel pain, Kim, whatsoever. Like it was just like normal pressure, but really no pain. So it was, I was very thankful to God. And then what made it really exciting to me and happy when I saw the kids next day. So I went to the hotel and I met the kids at the restaurant where we promised the plan. And the kids were shocked when they saw me because I was covering my wound with all this bandage, and I put my sunglasses so they don't see the bad thing. And my kids were wondering, what happened, Baba? I said, let's have fun. Baba is here, and let's have fun and play together and eat breakfast together. Somebody hit me, but I'm fine. That's the important thing. And we spent a good day, really. And that really what was happening during that injury. My parents keep calling me I didn't answer my phone, of course, because if my mom saw me, she would be, of course, not feeling well. I also am thankful because my mom was supposed to be with me that visit. And I told mom, don't come with me that visit for some reason. Just like I said, I was just going to go for 2 days and come back to Baltimore. So it's not worth it, the trip. So I was also grateful that my mom was not involved and my children was not involved in that injury. Then I came to Baltimore. I'm also thankful to John Hopkins, plastic and ENT surgeon. I got like a constructive surgery for nasal septal fracture. And I'm really doing great. I was taken care by our ophthalmologist here at Hopkins and did a great job. I'm recovering, I think, almost close to 100%. And one of the things was raised to me, Dr. Ammary, we were worried about mentally impact of the injury and how you're going to feel about this. And then I sat back, I said, let me tell you something here. If I was going to do one good to the public, now I'm going to do 10 goods. I'm grateful, I'm thankful to God, what happened to me, and for the support I got from people. Kim, you cannot imagine. I got so many messages from the nurses, from physicians, from the staff, from patients. I was like, it just was amazing. I got messages from people like I don't know them. So I was really felt like so appreciated of what people doing. And it just teach me like really a lesson that how to be respectful to other people and kind, no matter what, their race, their color, their religion, their tongue, whatever their background. We should really work together and judge people by their action and give them room. If people make a mistake, give them room. And I remember this lady, we were one day, like we were walking in a very crowded hall, and this lady said, listen, guys, there is room for everyone. So everyone has room. Don't feel that somebody will take your bite. Or, I mean, there is room for everyone. We just have to work together. So really, I mean, this is what I was going to tell you, Kim. I mean, I think this what happened to me is inspire me in a positive way how to give back to the society. The life I have now, I have just to pay back. Honestly, God gave me second life. So, and I hope I will meet people's expectation and God, trust that I will do well and positive to the community.
Wow. Everybody, do you hear this story and understand why I love this man? When Fawaz and I talked a few weeks ago, and I did not know about this Father's Day event, but when he told me the story, and then ended the story with, if I was going to do one good thing, I decided I was going to do 10 good things. I almost fell off my chair. And this is such an important lesson for so many of us. And I'm usually rambling a lot and just saying so many things, but I'm going to try not to say much because I want people to stop, maybe rewind and listen to your huge heart and the message of staying positive, even if fill in the blank. That's it. I mean, we all have a story. Everybody has a story. And many times we don't know each other's stories. And that grace and that mercy that you talked about of just pause a minute and give people some love and understanding and kindness. I just think you're amazing. I just love the story.
Thank you, Kim. That's kind of you.
Well, we're not going to leave on this end because Dr. Fawaz is very humble, and I know you don't want to tell this, but I want to end on something that is so amazing. Friends, you won't believe the blessings Dr. Al Ammary has since received. When I first met you, let's talk about when I met you in 2018. Dr. Fawaz was one of our EPIC faculty scholars. So the EPIC, medical records reporting system we came up in the Office of Faculty with this concept to give some money for faculty members to use the EPIC data towards scholarship. And Dr. Fawaz was one of our awardees of that opportunity. And I remember meeting him and talking about his project and WAGs, writing accountability groups. And at the time, I'm going to let you tell the rest of the story because you were working on something very important around 2018. So why don't you tell folks, work them through your accomplishments since that time and all these blessings that have you've been given?
Sure, Kim. So in short, I was grateful to John Hopkins that I was one of the first group awardees of the EPIC Faculty Scholarship. And that really initiated my energy and gave me courage to move on and support really. So I really was really a good trigger. And by the way, I was one of the finalists for using that EPIC project about reducing readmission after kidney transplantation. So in the School of Medicine. So it did pay off. And there is a model we created, a prediction. We're just trying to validate that model. So thank you for the support. In 2019, I was able to finish my PhD in health services research, and that was another milestone. What's really, I didn't tell you in the story. So the story happened, that my insult injury happened in June 2021, the Father's Day weekend. What I didn't tell you, that the same month, I was showered with 3 grants. So it was amazing. So the first grant was working hard on it. It's my NIH K23 grant using telemedicine for counseling and evaluation of living kidney donors. And I really appreciate the NIH funded me that grant. Same time, same month. Just like, it's just shocking to me, same month. I was also blessed by the National Kidney Foundation, the NKF, Maryland, Delaware, with a grant supporting me to create a model that predicts what will be your kidney function if you donate a kidney after donation. So I can tell you what will be your kidney in 6 months after donation, just for your counseling. So there was another grant, and then another grant came as a philanthropy grant from a kind donor, anonymous donor. I cannot mention their name, with a big money in support of my research to increase living donation in the United States. So it just was, Kim, I don't know how to tell you, but just like, yes, I got the insult injury and it looked bad, but I was, still, I took it positive, and I don't know, that turned out to be positive, and I got 3 grants. Now, what's the link between the two? I don't know. But I know like God was just testing me and to see how much confidence we have in God. Are we going to stay firm and positive and persistent, or are we going to give up? So the take home point, you never give up, just stay positive. If you got a flat tire, you fix it. So you don't say, I'm done. So thank you so much. And I hope, people take this message, like stay positive no matter what, and even if, and fill the blank in what happened in your life.
Folks, Dr. Fawaz Al Ammary, you can reach him at Fawaz Al Ammary at jhmi.edu. I'll spell that for you. FAWAZALAMMARY. Fawaz, I love you. Thank you so much.
Thank you so much, Kim. Appreciate it.
Thanks for tuning in to Faculty Factory Podcast. The mission of the Faculty Factory is to build and support a community of leaders in faculty development who share tools, resources, wisdom, and encouragement in service to our faculty members, schools, and institutions. We encourage you to go to facultyfactory.org to find out more, get in touch with me, ask me any questions. Maybe you want to be interviewed on the podcast. Thanks for tuning in to Faculty Factory Podcast. We'll see you next time. The Faculty Factory podcast and website is sponsored by the Johns Hopkins University School of Medicine Office of Faculty. For more information, visit facultyfactory.org.